Okay, I will gather my supplies. I will knock on the door, enter the patient's room, do proper hand washing skills, introduce myself. Hi, I'm Keisha. I'm your nurse for today. I'll be performing a head to toe body assessment. Can you tell me your name and date of birth?
Rashawn Pickens, 04/11/2003.
Okay, let me just check your wristband to make sure. Okay. Can you tell me where you're at for today?
In the hospital
And why are you here today?
for the full body assessment.
Okay, and can you tell me who's the president?
Joe Biden.
Okay, good. Patient is alert and oriented at ×4. Patient is aware of where he is and aware of his presence. As of inspection, I would inspect patient for any abnormalities, patient's hygiene, skin looks intact. We would check for symmetry of the head to make sure everything is normal. The eyes, ears, nose, and mouth, and no drooping of the face is present. So yes, we will start off with the head inspection. I will put on my gloves. We'll go ahead and start with the head. Okay, we'll start with the head. We will palpitate the patient's head. We're checking for any lesions. We're checking for any indentations. We're checking for any masses present in the head, as well as checking the patient's hair, just to make sure there's no infestation, there's no alopecia for baldness and things of that sort with the head, and no swelling or masses are present. Next, we'll go ahead and check the cranial nerve 5, which is the temporal artery. We'll palpitate the bilateral artery here. Next, we'll do the trigeminal nerve, and we'll ask the patient to bite down if you can. Can you bite down, clench your teeth, and now try to open? Yes, we'll check for strength with the patient's jaw muscle. There you go. And we'll go ahead and check with the eyes, your eye vision. If you can stare off into, and I'll take a look at your pupils here. Test the patient's eyes. We're checking for the eyelids, the sclera, the pupils, and the conjunctiva of the eyes. We'll go ahead and check for the pupils here. Okay. Everything looks clear. And then we'll do a test on there. If you could just follow my pen. We'll hold this about 12 to 14 inches. We'll test the patients and just follow the pen there. There you go. We're testing the patient. Okay, and one more test. We'll just follow the pen with your eyes. We'll go here, and here, here, and here, here, and here. Okay, good. Okay, what we'll do is we will hold your eye. Can you put one hand over your eye? And we'll test for confrontation tests. You'll hold one eye and then see and tell me if you see what numbers that I'm putting up, okay?
2, 1, 2, 1.
Okay, can you do the other eye for me, please? Okay, we'll test that.
2, 2, 1, 2.
Okay, thank you. Okay, we'll go and then we'll test for, and that's testing the, we tested for the ocular motor skills when we did the eye test, and now we'll be checking for the cranial nerve number 4. We'll test the ears. We test the ears for any abnormalities, We're checking the ears for any drainage or any type of infections. So we'll pull the ears up and back, and if we had our odometer, we would put it in the ear to test there, just checking for any type of tenderness. Do you have tenderness here in your ear? And then we'll go to this one here. We'll pull the ear up and back, check for any type of redness or abnormalities, which it looks great. Okay, now we would check for, we'll check the patient's nostril area. We'll be looking at in your nostrils, just checking for any lesions or redness. Can you hold your head back and look up your nose for any lesions or redness in your nose? Have you had any nasal problems with your nose?
No.
Okay, there's no redness, there's no lesions or polyps present in the patient's nose. And now we'll be checking your neck. If you can extend your head, we'll check your neckline, and we're checking midline for any lesions or lumps. And if you can swallow for me, great. We're checking for that. We'll have you okay. And we'll be checking cranial nerve number 6. We'll have you look up and down and side to side, and down, side to side. Okay, that is normal. Patient has no problem with that. And if you can shrug your shoulders for me, up, okay, and down. So, okay, so we'll be palpitating the neck area, the trach area. We're checking for any lumps or lesions here. No lumps are present in the trachea area. And then we'll begin to palpitate for the lymph nodes. We'll start with the preocular, then the postocular nodes, the occipital node, the parotid node, the tonsil node or something like that, the submental node, and the supravicular node here, and the submental node is here. We'll palpate the artery, carotid artery of the neck. We'll check here for your pulse, and you do that separate here. Check that. Okay, and then we'll go ahead and check your arms here for any skin lesions. Skin looks nice. We'll check your radial pulse, which is here. Your brachial pulse is here. Your radial pulse is here. Both arms. Radial, brachial. No abnormalities are present in the skin. Okay, we'll go ahead and check your lungs. Can you take your shirt off for me? We'll go ahead and check your lungs. We'll do it. We'll do your ears. Checking your lung area, and I would like for you to breathe in, deep breath in, deep breath, 2, deep breath, deep breath, deep breath. Deep breath. Deep breath. Deep breath. Nice deep breath. Good. We're listening for any crackling, any wheezing, any friction. If the patient would have any stridor sounds, we would listen for that. And that's with your lungs. Now we will go ahead and check your heart. I will need to listen to your heart. We will listen to aortic valve 1, S1. The pulmonic valve 2, S2. The Erb's point 3. The tricuspid 4. And the mitral valve here, 1 minute and 60 to 100 beats per minute for maximum impulse. Okay, and if I can get you, we'll just lay down here so I can check your abdominal. Here you go. Lay on your back. Okay. So we'll be checking for your abdomen. And I'll be listening to I'll inspect your stomach for any abnormalities. Patient's stomach looks normal. There's no lesions or any skin lesions present. We would inspect the stomach. And it's in 4 quads. Quadrant 1. We're listening for active bowel sounds here. Quadrant 2. Three and 4. Patient has active bowel sounds. Now we'll go ahead, lightly palpitate the patient's stomach. Any tenderness? Okay, I'll do this. Patient has no tenderness. Now we'll just do a little deeper tissue, feeling for any abnormalities present. Any tenderness? Okay. Okay. And we'll be listening to, so we'll do 2 inches down for light palpitations, 4 inches down for deep palpitations with patient's stomach. Okay, next we'll be checking our patient's legs and skin. Patient's legs are normal. There's no skin areas, are all intact. We'll check the popliteal arteries, feeling for your popliteal arteries. We're checking patient's leg for edema. For any edema, patient has no edema present. Checking for that. We'll be checking patient's capillary. And so I did mean to check your capillaries. We just hold that. Make sure the capillaries are popping back. Okay. And then we'll check for the patients. If I can just take this off of the be checking here. We'll be checking our patient's pulse rate here, and our dorsal pulse here. Make sure you do here, here, and here. Now I would like to test your strength. If you can push, okay, and lift your legs. Okay, good. Patient strength seems fine. And if you can sit up for me, please. We'll test the patient's, check for the patient's back area. Spine alignment and posture is good. Patient has no known lesions or abrasions that are present, and patient is normal. No findings. Thank you.